So on the day of surgery, when you come to the hospital, make sure that you have brought all the required necessary loose clothing which the nurses have advised you. A nightgown will be preferable. We will take you to your bed where the nurses will do certain paperwork. They will take your blood pressure, pulse, certain vital signs, because these are important as they tell us what condition your body is in. And we would like to maintain it all during the procedure. It might be that you may feel that the same thing is being repeated again and again, but the paperwork is a very important aspect. So the nurses will be taking a lot of paperwork, the surgeon will be going through a lot of paperwork, and so will the anesthetist who you will meet on the day of surgery, who will go again through a lot of paperwork. If it is a general anesthesia case, I would advise you to stay fast from midnight, preferably, if possible, and if not, at least 6 to 8 hours before surgery, not to eat or drink anything. When you come to the hospital, we will make sure that you are comfortable, you are in a nice environment, and we'll take you to the operating theatre after doing all these necessary and important checks. In the operating theatre, the nurse will help you and take you and guide you through the procedure. Anesthetist will be at hand who will be putting most probably a needle in the back of your hand. Some people are a bit afraid of putting these needles in the hand, so we can do a gas induction as well. It's just like that you are put to sleep, and when you wake up, you are in the recovery and the surgery has been done. That is where I come in during the surgical procedure. We would have discussed what your expectations are, and I would have told you before surgery in the consultations what can be achieved, and I will try to achieve those targets which we had decided before the surgery. After the surgery, we would prefer that you stay in the hospital for a few hours until at such time when we are happy that you are comfortable enough to be discharged back home. While you are in the hospital after your surgery, there are nurses who will be looking after you so that your care is kept up to the maximum comfortable level, and we look after your surgical site and to advise you how to look after it before you go home. Before you go home, we will give you advice on those particular garments that you have to wear after surgery while you are at home, so that it helps in a speedy recovery and a good healing of the wound scar.